Imagine a world shrouded in darkness, devoid of light and color. This is the reality for individuals suffering from severe corneal blindness. Fortunately, a beacon of hope emerges from a surprising source: our very own teeth. Osteo-odontokeratoprosthesis, also known as tooth-in-eye surgery, offers a chance to restore vision in these cases. OOKP might sound like something out of science fiction, but this groundbreaking procedure is very real. It involves transplanting a patient's tooth and surrounding tissue into their eye to create a new window for light to pass through. This innovative technique has transformed the lives of countless individuals, allowing them to experience the world visually once again. This procedure is not a quick fix. It is a complex, multi-stage process. However, for those facing the prospect of perpetual darkness, the potential rewards of OOKP are immeasurable. This essay explores the intricacies of this remarkable surgery, delving into its history, methodology, benefits, and future prospects. The OOKP procedure is a testament to medical ingenuity, requiring multiple stages to achieve its remarkable outcome. First, a skilled oral surgeon extracts one of the patient's canine teeth. This tooth is chosen for its robust structure. Next, the tooth is shaped and prepared. A hole is drilled and a plastic lens is fitted inside. The implant is then placed into the patient's cheek for several months. New blood vessels and tissue grow around the implant. The surgeon removes scar tissue from the cornea and replaces it with healthy tissue. Finally, the tooth lens implant is transplanted into the eye socket. The surrounding tissue is sutured and the eye is monitored for healing. While OOKP offers a life-changing solution for some, it's not a universal remedy for all types of blindness. This procedure is specifically designed for individuals suffering from severe corneal blindness, a condition where the cornea, the transparent outer layer of the eye, becomes damaged or opaque, preventing light from reaching the retina. Common causes of corneal blindness include chemical burns, severe infections, certain autoimmune diseases, and genetic disorders. In these cases, traditional corneal transplants often fail due to extensive damage or a high risk of rejection. This is where OOKP emerges as a beacon of hope. OOKP is particularly effective for patients with conditions like Stevens-Johnson syndrome, a rare and serious disorder that can cause severe damage to the skin and mucous membranes, including the eyes. It is also a viable option for individuals who have undergone multiple unsuccessful corneal transplants, providing a last resort for restoring their sight. However, it is essential to note that OOKP is not suitable for all forms of blindness. Patients with damage to the optic nerve or retina, for instance, would not benefit from this procedure. Section 4. Restoring Vision and Hope, a Success Story. One of the most compelling aspects of OOKP is its ability to transform lives, offering a second chance at sight for those who had resigned themselves to a life without it. Brent Chapman, a Canadian man who lost his vision at the tender age of 13 due to Stevens-Johnson syndrome, embodies the life-altering potential of this procedure. After enduring 50 unsuccessful surgeries over the course of his life, Brent had all but given up hope of ever seeing again. However, his outlook changed when he learned about OOKP and the story of a woman who regained enough vision to ski after 20 years of blindness thanks to this groundbreaking procedure. Inspired by her story, Brent decided to pursue OOKP. The complex surgery was a success, and after a period of recovery and rehabilitation, Brent experienced the world visually for the first time in decades. This remarkable outcome underscores the transformative power of OOKP, offering not only restored vision but also renewed hope and a brighter future for individuals like Brent. Section 5. The Past, Present and Future of OOKP Surgery. OOKP surgery began in the 1960s, pioneered by Italian ophthalmologist Benedetto Strampelli. He used a patient's tooth as a base for a corneal implant, revolutionizing ophthalmology. Initially met with skepticism, OOKP gained recognition through success stories. Today it's performed globally, offering hope to those with severe corneal blindness. Despite its success, OOKP is rare due to its complexity and need for skilled teams. Research in bioengineering holds promise for the future of this surgery. Scientists are exploring 3D printed biocompatible materials to replace the tooth. This could simplify the procedure and expand its availability. The future of OKP shines bright, promising restored sight for many.